Let me thank you all for being present. Today I'm here with Mayor Pro Tem Dave Martin, Councilmember Pollard, and Councilmember Alcorn. Also, Chief Pena, Chief Acevedo, Dr. Persse, Stephen Williams. Director Williams is also present. Let me just say that the Houston Health Department today is reporting 963 new cases of COVID-19, bringing Houston's total to 24,336. And as you can see, the numbers kind of fluctuate. On Saturday, we, I think, reported 234. Yesterday, Sunday, was 489. Today, the number is 963. So we still have a lot of work to do, Houston, to slow the progression and bring this virus back under control. And so now the good news for today is that we're not reporting any new deaths. We didn't report any new deaths yesterday. We're not reporting any new today. But I would tell you the death count is kind of like a lagging indicator. The more the community spread, the more people go to the hospital, the more they go to ICUs. And then that's when the death count starts to creep up. Hopefully that will not be the case. And so we just need to work together collectively to blunt the progression of this virus. Now let me just say, we are, again, we're sending a letter, plan on sending a letter to the executive director of the Republican Party of Texas, strongly encourage the GOP to cancel its in-person convention scheduled to take place on July 16 at the George R. Brown Center. I believe canceling the in-person convention is the responsible action to take while we are in a critical moment in our battle against the COVID-19 pandemic. The virus continues to spread in our community, and we must protect the employees, the people who are in our city, visiting our city, as best as possible. And so let me just say this, in this city, all other conferences and conventions have canceled or been rescheduled to next year, with the exception of one. All of our conferences, all of our conventions that were scheduled to be in the city of Houston at the George R. Brown have canceled or been rescheduled to next year, with the exception of one, and that's the State Republican Convention. And so, and we have to be mindful. And I would ask them to be mindful of the employees, the people who are working at the George R. Brown Convention Center, people who are working even at the hotels, people who will be serving them. Be mindful of their health, the people who are visiting, the people who, for example, who are living in the city of Houston in the midst of this pandemic, and be mindful of what we are facing right now. I've not yet talked to a medical professional who has said that this is a good idea to hold this convention at this time. I visited extensively with Dr. Persse, talked to Dr. Peter Hotez, just talked with him again today. All are saying that this hosting a convention, an indoor convention at this time in the city of Houston is a bad idea. And I'm going to call on the sponsors of this particular convention to join in with us in asking the State Republican Executive Committee to cancel their plans to have an in-person convention in the city of Houston at this time. And I would strongly recommend that it be a virtual event. As I continue to evaluate this convention, having a convention in person in the city of Houston, at a minimum, there are certain things that will be asked of the people if they elect to proceed, and if not, additional action is taken by the city. There are certain things that will have to take place, and this will be forwarded to them as well. They must enforce the governor's executive order on the use of face coverings, masks, or face shields if face coverings are not available. That will be a must, not only to get into the convention, but while they are participating in the convention where there is more than one person present, face coverings will be a must. In addition, they must modify the layouts of the convention to promote social distance of at least 6 feet between people, limit attendance, seating capacity, or host smaller events in larger rooms. Use multiple entrances and exits and discourage crowded waiting areas. Block off rows or sections of seating in order to space people 6 feet apart in all directions, left, right, back, and front. Eliminate any lines and encourage distancing by providing signs or visual cues. Install physical barriers and guides to support social distancing. Serve individually plated meals, grab-and-go options, and hold activities in separate areas. Limit the use of elevators and ensure that the number of people using the elevators. Encourage attendees to use transportation options that minimize close contact with others. Limit non-essential visitors and volunteers and activities involving external groups or organizations, especially with those who are not from the local area. Conduct daily health checks, such as temperature screens or symptoms checking on all staff and attendees. Use wristbands to validate daily health checks. Keep a track of attendees by sections, i.e. Signing sheets, scanning, etc. Keep a master list of all attendees that includes the following information: name, date of birth, address, phone number, email address, hotel and hotel rooms. Put in place communication systems for individuals who may self-report COVID-19 systems. All of that will be required. Attendees who develop symptoms or test positive for COVID-19 during the convention or on the 2 weeks following the convention must notify convention organizers, who will then coordinate with local public health in Houston and in the attendees' local jurisdictions. All of these measures and more have been put together by Dr. Persse and his health team. All of this will be made available to the executive committee. We expect all of these rules to be strictly adhered to if this convention should go forward. In addition, there will be health inspectors and monitors that will be at the convention the entire time. To the extent any of these measures are not adhered to and adhered to in the strictest of terms, then the health inspectors will have the authority to immediately close the convention at that point. These are serious times, and this pandemic is very serious, and we take it very seriously. And because of the situation that we find ourselves, it is important, for example, that we take every conceivable measure to protect the health and safety of these employees and their family members, as well as the people in our city, all of the people in our city, the delegates themselves, and as Dr. Hotez mentioned, many of the delegates who will be attending fall within that vulnerable population. And so we want to be sensitive to them as well. I do not think it is wise or prudent to hold an in-person convention of 6,000 or more at this point in time. And again, I will call upon the executive committee as well as the sponsors to change their minds, to go to a virtual convention, and especially the sponsors of this convention. I would ask for them to reconsider their position, and as best as possible, we'll provide a list of sponsors and encourage them to join with us and the Texas Medical Association in encouraging the State Republican Executive Committee to head to a virtual convention. But if not, all of these conditions and others will be required. These are not optional. These are things that must take place, and they must be strictly adhered to. Having said that, let me yield and bring up Dr. Persse. There you are.
Thank you, Mayor, and I echo the Mayor's sentiments about the convention. I think that the wise, prudent thing to do would be for the Republican Party of Texas to reconsider their position, keeping in mind their members and the people who will be supporting that event. The virus is serious, okay? We've got, here in Harris County alone, again today, we have over 500 people in intensive care units within Harris County. And there's another over 1,300, I believe today, people admitted to local hospitals. They're sick enough to be admitted to the hospitals. The hospitals are working together to transfer patients amongst them. Now, these are hospital systems that don't routinely work together. They are businesses, and there's some, they're like siblings. There's some sibling rivalry, there's some sibling dependency, but they are, from a business standpoint, they're often in competition. Well, they are not in competition now. They are extremely dependent on each other as they try to manage the patient load. And so another large event like this, which is known as a super spreader event, is probably not the most responsible thing to do. And so I call on the RPT to consider a virtual convention, which can be highly effective. Others have done it. I think all of us now in business are having virtual meetings every day. And so I think that's a viable option for them, and I hope that they will consider that as the best route forward. In addition, there have been a couple of things that have been in the popular media that sort of need to be mentioned in light of the conversation we're having, and that is that there's evidence now that the virus may have yet mutated yet again. So we spoke several weeks back about, probably a month or so ago, about how the virus had mutated in Northern Europe and it became more easily transmitted. So there are some reports out now. This is very fresh information. It's just coming out. And some of the popular news feeds have picked up on it ahead of time, so I haven't actually seen the scientific paperwork on it yet. But it appears that the virus has mutated yet again, allowing it to spread even more easily. Now, fortunately, it does not appear to be any more lethal, so that's good news, but it's spread more easily here, and this is a new twist that appears to have occurred here in the United States, this new mutation. Simultaneously, there is a document of over 200 signatures from scientists around the world going to the World Health Organization asking them to reclassify the virus from being droplet transmission to airborne transmission. And so what that means is that when it's droplet transmission, that the virus would need to be in a droplet. Now, those droplets can be microscopically small, so that you don't see them with the naked eye. But even so, they tend to still fall out of the air. And so this is where the 6 feet for 15 minutes rule is based on the behavior of droplets. If the virus is actually airborne, and there are other airborne viruses, and I always use the example of measles virus, that means it doesn't need to be attached to a droplet. And it's that droplet that pulls it out of the air. So if the virus is actually able to survive on itself in the air, it is so very light that it will float around in the air for quite some time. That would be a game changer for us. And if that's the case, if this virus is maybe these two things that we're seeing are related, maybe the mutation not only makes the virus more easily transmitted, but it also is what's allowing it to be airborne. If that's the case, then that means that a super spreader event like a convention would be probably triply dangerous at this time. So the virus is changing. Our environment, as we learn about this virus and as it changes, is constantly changing. And I want to remind folks that today in Harris County, over 500 people are admitted to intensive care units. They are extremely sick. When you hear the testimonials from these folks, they will tell you that they were afraid that they were going to die. Now, they survived. That's how they were getting the testimonial from them. And I remember in medical school being taught, I had a very elderly professor, I'll never forget, he said the way you diagnose the flu is the patient wakes up feeling fine. By noon, they're so sick they're afraid they're going to die. By 5 o'clock, they're so sick they're afraid that they won't die. So we're hearing these testimonials from people who are so sick, they were afraid they were going to die. And I actually heard some said they were so sick that they were afraid that they weren't going to die. They were so sick that they felt they would rather have died than have to suffer anymore. So the fact that it's younger people who are getting it and people aren't dying as much completely misses the fact that this virus, for the people who are getting sick and winding up in the hospital, are having terrible, terrible times. And now that their families are going through terrible, terrible times as they worry about their loved one who's in the intensive care unit suffering. And they are suffering with a capital S. So please, let us not underestimate, just because people aren't dying at the rate that they may have been, that this virus is any less dangerous or painful to those who get it.
Chief Pena.
I don't know how to follow that up. That's not good news, Dr. Persse. For the fire department, I want to give you the numbers that we see in quarantine as of today. We are still around 280 firefighters that are in quarantine, and those are firefighters that have been exposed in and outside of work. The majority of those have come from community spread. We continue the same posture on the fire department to provide the tools, the equipment, the protocols, the support for our fighters to remain safe. But we are seeing an enormous amount of firefighters that are being exposed through family members, relatives, just the activity in the community. I want to make one thing clear, is the staffing issue is something that we have been talking about here for weeks. We've been mentioning the fact that as more firefighters are in quarantine, it's stressing our ability to staff our units. But I want to make one thing clear, because this is in the media and it's been put out, there are no fire stations that are closed. If there are issues with staffing, we're going to prioritize the staffing on our ambulances and fire engines, but every station will have a fire engine at least inside those stations. Okay, I want to clarify that. I want to remove any doubt or any misconception about what this means. We are working overtime to ensure that we're bringing people in. Our firefighters are working extra shifts. They're volunteering for voluntary overtime. We're keeping them in there at the stations, those that until we find proper relief. And I appreciate the effort that they're putting out in order to protect this community. But I just want to make sure that we're clear on what the impact is to this community. We are not closing any fire stations. Our response times for June are about 7.5 minutes, 7 minutes, 18 seconds. And that has gone up a little bit since January, about 20 seconds since January. So we're maintaining the operations. That doesn't mean that we're not being stretched thin. We have about 1,100 calls for service each and every day. And this is an opportunity for me to remind our community to make a judicious use of the 911 system. 911 system is there for you to call when it's a true medical or safety emergency. Okay? We want to reserve those precious resources for the critically ill and those emergencies that are life-threatening. We don't transport people to the hospital to get tested or evaluated for COVID. Okay? I mean, that's not the proper way or proper use of our resources. And the hospitals are seeing a saturation as well. So you're not going to be seen any quicker if you go through the ambulance. But if you're having an emergency, a true medical emergency, chest pain, stroke, labor, any of those issues, call 911. That's what we're there for. And we're going to have plenty of resources. All our fire stations are staffed. Again, we're prioritizing our ambulances and our fire engines here in this critical staffing situation. That's my report. Thank you, Mayor.
Chief Acevedo.
Thank you, Mayor. Good afternoon, everybody. Currently, we have 206 members of the Houston Police Department that are quarantined, and we've had up to now, Mayor, 263 positive tests in our department. We've had 116 that have returned to duty, 120 when you add our 4 civilian classified, civilian and support staff. And I'd like to just tell the community we're continuing to be fully staffed and fully capable to respond to any eventuality. And so it's having a minimal impact on our operation. But the good news is that most of our people have returned to work. We did just receive word a little while ago that one of our sworn members is now on a respirator, so I'm not going to release the name until I talk to the family, but you can just send prayers for someone that's in pretty tough shape right now, so we're worried about this employee. And with the permission of the family, we'll try to get out the name later so we can be deliberate on who we are praying for. That's our report, Mayor.
Thank you, Chief. As COVID-19 cases surge across Houston, Hispanics are affected in disproportionately higher numbers. The Houston Health Department is today launching a 21-day emergency outreach program, Better Together, Todos Juntos, Mejor, to curb the ravages of the disease in this vulnerable population. The program educates Hispanics about the combination of behaviors proven effective in preventing the spread of the virus and helpful resources to locate and use free testing sites throughout the city. It also shares valuable information for families requiring assistance with food, housing, and mental health issues. The initiative will reach the Hispanic community through culturally relevant messaging and vehicles, including a virtual media tour that took place this morning, Trusted Voices Toolkit for community organizations, influencer message amplification, paid social media advertisements, and more. So again, let me just say that we're in the midst of this pandemic. Again, I'm asking all Houstonians over the next several weeks to come together and let's do everything on our part to slow the progression of this virus. Please wear your mask. Please do that. Please engage in social distancing, exercise proper hygiene. And again, I want to call on the State Republican Executive Committee to reverse this decision, not to have an in-person convention, but to have a virtual convention, which would be in the best interest of everyone. And I certainly want to thank all of those other organizations, groups, who have elected to cancel and reschedule their conferences and conventions until next year. This is the only one that's remaining for the greater good of everyone. I'm hoping that they will reschedule or cancel and turn to a virtual conference.